Great. And you've been here with our practice for how long now?
Maybe a little over 5 years.
Okay, great. And we're treating you for glaucoma. And over the last 5 years, your glaucoma with surgery and medications has been very stable. Here we did a visual field. The right eye, she's lost about 30% of her vision. The left eye is actually full, pretty good over here. And so tell us what it's been like to have surgery for glaucoma in your right eye and take medications. Tell us what that was like for you.
I was extremely nervous about having the surgery because I knew that after I've been doing this since I was 21 years old. So medication has always been something that stabilized me until the point where I went to doctors and they felt that I was no longer stable. So when I came to you, you said that there was an operation for me. Difficult because I have osteogenesis imperfecta and I have blue sclera, so makes operating on the eye a little bit more difficult. And so I had to find somebody that was willing to do something like that for me. When I had the eye done, it was scary in the beginning because my vision didn't actually come back for a little while. Once it did, though, I actually had a little improvement in the vision. And then automatically, the pressures were stabilized. So in that respect, I think that it was like a godsend for me because I knew that I was losing the vision in that right eye. So my choices were limited. And so you felt that there was and you were right. I mean, the tube actually lowered my pressure right away. I have had to have it twice done. It could be for the first time, maybe because you didn't put the patch on, which I didn't want. You can see the patch a little bit, but for me, it was the only way of keeping the tube in place, I guess, to have it efficiently work.
Okay, so the first one we did was a suprachoroidal tube, and the second one we did was a retrobulbar tube. May we take just a quick look down for a second? We can see the eye patch over here that's covering the retrobulbar tube, and that's the one that really helped to control the pressure very well for a long period of time. And so what advice would you give for patients who may be scared to have the glaucoma tube shunt surgery? That's usually reserved for advanced glaucoma patients.
Right.
What advice would you have for those patients?
I would say that you really have to do your homework and going shopping for a doctor that is willing to do the advanced work on you. That I felt like Dr. Laroche was not afraid of me. I have gone to doctors that were afraid to touch me because I'm a little bit different in the eye. And he convinced me that I was going to have lower pressure. It was that I had lower pressure right away. It's a process. The vision takes a while to feel like it's coming back, after you have the surgery and you question yourself. But in the long run, I stuck in there and the pressure has been stable for at least 5 years or better. I think I've been here longer, so.
Okay, great. Thank you so much for sharing this experience. I think it's going to help a lot of patients who are a little hesitant and undergoing some of planning, potentially some of the things that you've been through already on this date of December 19th, 2024. Thank you so much.
Thank you.